There are very few illnesses where doctors start treatment before they even have a confirmed diagnosis. Meningitis is one of them, because waiting can cost the brain hours it simply doesn't have. What makes meningitis so terrifying isn't just the infection itself. It's just how incredibly fast it can move from what seems like a mild fever to a full-blown neurological emergency often, before anyone realizes just how serious the situation is. Medically speaking, meningitis is the inflammation of the meninges, which are the protective layers surrounding your brain and spinal cord. And despite all our modern vaccines and advanced medicine, it remains one of the most time-critical conditions that doctors face in the clinic. You see, most infections give your body some time to respond, to fight back. Meningitis doesn't play by those rules. The brain is enclosed in a rigid, bony skull. So, when inflammation begins inside that fixed space, the pressure starts to rise very quickly and the brain has absolutely no room to expand or adapt. This is why meningitis isn't dangerous in a matter of days. It's dangerous in a matter of hours. And here is the part most people don't realize. The damage isn't just caused by the germ, the bacteria, or virus. It's also caused by the body's own powerful immune response, which, in its effort to fight the infection, causes the brain to swell. This is why timing is more critical in meningitis than in almost any other condition. Every minute that passes, the pressure can increase, and the risk of permanent damage goes up. Now, not all meningitis is the same, but in the emergency room, doctors have to treat every single suspected case as serious until proven otherwise. Viral meningitis is the most common type. It often improves on its own with supportive care, like rest and fluids. The problem is, in its early stages, it can look exactly like its more dangerous cousin. That cousin is bacterial meningitis. It's less common, but far more severe. A person with bacterial meningitis can go from feeling a little unwell to being critically ill within just 6 to 24 hours. Then there's fungal meningitis, which is rare and primarily affects people with weakened immune systems. Clinically, it is the threat of bacterial meningitis that drives the extreme sense of urgency you see in hospitals, because the outcome for a patient can change dramatically before the day is even over. One of the most dangerous things about meningitis is how normal it can seem at first. The early symptoms often look completely harmless: a headache, a fever, maybe some fatigue or nausea. This is the critical window where many people, understandably, lose precious time, thinking they just have the flu or a common cold. They rest, take some over-the-counter medicine, and wait for it to pass. But as the inflammation inside the skull gets worse, the real warning signs, the red flags, start to appear. Things like a stiff neck, a severe sensitivity to light, confusion, or increasing drowsiness. In children and teenagers, the signs can be even quieter and easier to miss, things like irritability, not wanting to eat, or being unusually sleepy. By the time these classic symptoms are obvious, the disease may have already gained a dangerous foothold. This is precisely why doctors don't wait. When a patient arrives with symptoms that even hint at meningitis, treatment often begins immediately. That means antibiotics are started before the lab results come back, before there's definitive proof. It's a treat first, confirm later approach, because neurological injury can start long before the diagnosis is finalized. In this race against time, speed is what protects the brain. Even with the best and fastest treatment, some survivors of bacterial meningitis may face long-term consequences. These can include hearing loss, learning difficulties, memory problems, or other cognitive impairments. These outcomes are not rare, especially when there's a delay in getting care. The difference between a full recovery and a lifelong impact often comes down to those first few hours. With all that said, the most effective way to fight meningitis isn't treatment, it's prevention. Vaccines against the most common causes of bacterial meningitis like meningococcal, pneumococcal, and Hib infections have dramatically reduced the number of severe cases around the world. From a public health perspective, these vaccines have successfully turned a potential medical catastrophe into a largely preventable disease. So while doctors stand ready to fight it, our best defense happens long before anyone ever gets sick. The reality is, meningitis is uncommon, but when it does strike, it is absolutely unforgiving. It doesn't wait for certainty. It doesn't wait for the symptoms to become clear and obvious. And most importantly, it doesn't give the brain much time to spare. Understanding the signs of meningitis isn't about living in fear, it's about recognition. It's about knowing when a simple headache might be something more, and when it's time to act without hesitation. That knowledge can be the key to preserving brain function and ultimately saving lives. Thanks for watching.